This is Dr. Gutierrez with World Stem Cells Clinic. I wanted to take a moment today in this, make a quick video to answer a question that our patient coordinators and myself have been hearing quite a lot recently regarding stem cell therapy for autism. Certain places where people have sought out stem cell treatments are telling them that it's better to be less invasive, and so they are not advocating, or they're not performing lumbar punctures and intrathecal stem cell infusions. They're only doing an IV infusion. Now, what's the reasoning behind this? They claim that this is safer. Um, why then do we do intrathecal infusions and IV infusions? Because we do both. We do two IV infusions, one with the concentrate and one with the post-expanded cells, which is something that almost nobody can do, which is cellular expansion. And we also do intrathecal infusion. So why do we do this? And the reason is simple. Our goal with our advanced stem cell therapy for autism is to get stem cells into the patient's brain so that that brain can recover some of its neural plasticity. What does it mean to you? We want to make sure that that brain recovers its ability to create neuronal connections so that that child can learn new things, can respond better, can articulate better, can be more present, can behave better. The only way to do that is to go directly into the central nervous system. You see, there is something really, really great, and it's called the blood-brain barrier. And what the blood-brain barrier is, it's basically, as its name implies, it's a barrier that protects our central nervous system from anything and everything that could be flowing through our bloodstream. And that's actually one of the reasons why the central nervous system isn't naturally as good as, for instance, your lungs or your liver or some of your other tissues to repair itself. And that's because this blood-brain barrier won't let our normal flow of stem cells and repair cellular mechanisms to actually go in there. So what we need to do is we need to actually grab those concentrated stem cells and put them into the intrathecal space. We need a specialist. We need, in our case, we have a pediatric anesthesiologist who does this and who's done thousands of these procedures and does them so safely and so quickly and effectively that it's virtually painless and it's pretty straightforward. I am guessing that some places are advocating towards a safer approach because they don't have access to these specialists, or they have no way of determining that the stem cells are completely pure and sterile like we do in our lab. I don't know the reasons through this. I believe that as a parent, looking out for your child and then researching different treatments, you want to know what is best. Now, think about it. You don't need a specialist to tell you this. What do you think is best? If we normally have a barrier that protects our central nervous system, where your child's problem is, by the way, um, why do you want to go into the veins and try to get those cells to pass that barrier instead of actually going into where the problem area is? It simply doesn't make sense to me. Unfortunately, there's a lot of misinformation being spread around. There's many places that are telling people, that are giving people wrong information, um, which is quite unfortunate. And that's probably the reason why we have, over the past 4 years, received a lot of patients who have seeked out stem cell therapies elsewhere and received no improvement, and we have been able to provide improvement for them. Um, in any case, that's all I really wanted to address in this video. I don't want it to go too long.